For many men, the gradual decline in erection strength feels like an inevitable part of aging, a sign that vitality is slipping away. But what if I told you the real issue might not be your age, your hormones, or even your lifestyle, but something as overlooked as your oral health? That inflamed gum you dismissed, that hurried brushing routine, or the plaque quietly building up in your mouth could be the hidden culprits sabotaging your performance. I'm Dr. James Carter, a urologist with over 30 years of experience specializing in men's sexual health. I've worked with hundreds of men in their 60s, 70s, and beyond, helping them reclaim their confidence, not through expensive pills or invasive treatments, but by focusing on something surprisingly simple: their dental hygiene. In this video, I'm going to walk you through 5 practical science-backed dental habits, plus 1 unexpected bonus tip that can protect your blood vessels, boost nitric oxide production, and rebuild the foundation for stronger, natural erections. These aren't complicated or costly solutions. They're affordable steps you can start tonight. I'll also share details about a remarkable probiotic from a European study that slashed gum inflammation by over 70% in just 6 weeks, offering a powerful boost to vascular health. If you've been quietly struggling in the bedroom or simply want to maintain your vitality as you age, don't tune out. This information could change everything. Before we dive in, make sure to subscribe and hit the notification bell so you don't miss future health tips tailored for men over 60. In the comments, let me know if this topic resonates with you by typing 1, or if you'd prefer other health topics, type 0 and share your suggestions. Let's get started with the science behind why your mouth holds the key to your erections. The surprising link between your mouth and erections. Your oral health isn't just about a bright smile. It's a critical factor in your ability to achieve and maintain strong erections. The connection lies in your vascular system. Erections rely on robust blood flow, which depends on healthy blood vessels, and a molecule called nitric oxide that allows those vessels to relax and expand. Poor oral hygiene, particularly gum disease, triggers chronic inflammation that spreads through your bloodstream, damaging the delicate lining of your blood vessels, the endothelium, where nitric oxide is produced. Without enough nitric oxide, blood flow to the penis is restricted, and even the strongest desire can't translate into performance. Scientific studies have uncovered a startling fact. Bacteria like Porphyromonas gingivalis, a primary cause of gum disease, don't stay in your mouth. They've been found in the arteries of the heart, brain tissue of Alzheimer's patients, and even penile tissue, contributing to inflammation that undermines circulation. This isn't just about cavities or bad breath. It's a direct assault on the vascular system that powers your erections. I'll never forget a patient named Robert, a 67-year-old former teacher who came to my clinic feeling defeated. Despite normal testosterone levels, controlled blood pressure, and a healthy diet, his erections were fading, and it was straining his marriage. During our consultation, I asked about his dental habits. He hesitated, then admitted he hadn't seen a dentist in nearly a decade. His gums bled regularly, but he thought it was no big deal. That conversation was a turning point. By addressing his oral health, we unlocked a solution that not only improved his gum health, but also restored his confidence in the bedroom. Let's explore the 5 dental habits that can do the same for you, starting with the most fundamental one that most men get wrong. Dental trick number 1, brush properly twice daily. Brushing your teeth seems like the most basic habit, but it's shocking how many men, especially those over 60, aren't doing it effectively. Proper brushing isn't just about preventing cavities or freshening your breath. It's about stopping harmful bacteria like Porphyromonas gingivalis from triggering a cascade of inflammation that affects your entire body. This aggressive bacterium thrives along the gum line, forming plaque that, if left unchecked, hardens into tartar and slips into your bloodstream, attacking the arteries that supply blood to the penis. The key to effective brushing is technique. Forget the aggressive side-to-side scrubbing that can damage your gums. Instead, use gentle, circular motions at a 45-degree angle toward the gum line to dislodge plaque without irritation. Spend a full 2 minutes, set a timer if you need to, covering all 4 quadrants of your mouth: upper left, upper right, lower left, and lower right. An electric toothbrush with soft bristles is a game changer, especially if arthritis or reduced dexterity makes manual brushing challenging. One of my patients, a 72-year-old named Tom, was diligent about brushing, but used a hard-bristled toothbrush and rushed through it in 30 seconds. He was frustrated by persistent gum bleeding and a noticeable decline in his sexual health. After switching to a soft, bristled electric toothbrush and committing to 2-minute sessions twice daily, he noticed his gums stopped bleeding within weeks. More surprisingly, he reported feeling more alive in intimate moments. Brushing with intention is a small act of self-care that protects your vascular health, reduces inflammation, and supports the blood flow essential for erections. It's not just cleaning your teeth, it's reclaiming your vitality. Dental trick number 2, floss every day, no excuses. Flossing is the dental habit most men skip, but it's one of the most critical for protecting your erections. The tiny spaces between your teeth are like hidden bunkers where bacteria like P. gingivalis thrive, forming sticky plaque that your toothbrush can't reach. If ignored, this plaque hardens into tartar, pushing your gums away from your teeth and creating pockets where bacteria can enter your bloodstream. This triggers silent, chronic inflammation that narrows blood vessels, reduces nitric oxide, and directly impacts your ability to achieve strong erections. Flossing takes just 2 minutes a day, but its impact is profound. I had a patient, Michael, a 70-year-old retired firefighter, who brushed twice daily but hadn't flossed in years. His gums bled regularly, and he was struggling with inconsistent erections, which left him feeling disconnected from his partner. When I explained the link between gum health and blood flow, he committed to flossing every night. Within a month, his gums were healthier, the bleeding stopped, and he confided that his confidence in the bedroom had returned. If flossing causes discomfort or bleeding, don't give up. That's a sign of existing inflammation, and consistent flossing will help your gums heal. Use wax floss or floss picks for easier handling, and move gently to avoid irritation. Flossing isn't just about clean teeth, it's about shutting down the pathway that allows bacteria to harm your vascular system. It's a quiet act of self-respect that says, my health matters. Dental trick number 3, use interdental brushes for deeper cleaning. As we age, our gums naturally recede, leaving wider gaps between teeth where bacteria can hide. Even the best flossing technique can't always clean these spaces thoroughly. That's where interdental brushes come in, small, bristle-tipped tools that look like miniature pipe cleaners. They're designed to reach deep into gaps, removing plaque and bacteria that contribute to inflammation. By keeping these areas clean, you protect the blood vessels that support nitric oxide production and healthy erections. I recall a 65-year-old patient, David, a construction business owner who was skeptical about interdental brushes. He already brushed and flossed, but still dealt with occasional gum sensitivity and felt his energy and performance waning. After adding interdental brushes to his routine, he was amazed. Within a month, his gums felt stronger, his morning breath improved, and he noticed a subtle but undeniable improvement in his sexual health. He described it as feeling like my body was working with me again. Interdental brushes come in different sizes, so consult your dentist to find the right fit. Use them gently once a day, ideally at night, to complement flossing. This small tool can make a big difference, breaking the cycle of inflammation and supporting the blood flow that powers your erections. It's a simple step that feels like fine-tuning a precision machine. Your body, dental trick number 4, add Lactobacillus reuteri probiotics to your routine. Your mouth is an ecosystem of bacteria, some harmful and some protective. Lactobacillus reuteri is a beneficial probiotic that can shift the balance in your favor. In a clinical study involving European sailors on extended missions without dental care, lozenges infused with reuteri reduced gum bleeding by over 70% in just 6 weeks. They also significantly lowered levels of P. gingivalis, the bacteria linked to gum disease and vascular inflammation. By reducing inflammation, this probiotic supports nitric oxide production, which is critical for healthy blood flow and strong erections. One of my patients, a 64-year-old accountant named Stephen, was doing everything right, brushing, flossing, and even using interdental brushes, but still struggled with gum sensitivity and lackluster performance. I recommended reuteri lozenges, One dissolved in his mouth each evening. 2 months later, his gums were healthier, his breath fresher, and he felt a renewed sense of control in his intimate life. He described it as, like my body finally had the support it needed. These lozenges are safe, natural, and easy to incorporate. Simply let one dissolve in your mouth before bed. No swallowing, no side effects. Consistency is key. Think of it like nurturing a garden. Regular use strengthens your oral microbiome, which supports not just your gums, but your overall vascular health. It's a small addition with a big impact. Dental trick number 5. Schedule professional cleanings every 6 to 12 months. No matter how diligent your home routine, tartar buildup requires professional intervention. Dental cleanings every 6 to 12 months remove hardened plaque that traps bacteria like P. gingivalis, preventing it from fueling inflammation that damages blood vessels. This is critical because chronic inflammation silently interferes with nitric oxide production, tightening the arteries needed for healthy erections. I had a patient, Bill, a 71-year-old avid golfer, who was fit and active but noticed a gradual decline in his sexual performance. He brushed and flossed regularly but hadn't seen a dentist in over 3 years. After a deep cleaning to address early gum disease and committing to biannual visits, he returned 6 months later with a grin. "Doc, I feel like my body's got its edge sparked back," he said. His improved blood flow wasn't just about his gums, it was about his entire system working better. Professional cleanings are like a reset for your oral health, clearing out what your toothbrush and floss can't. If it's been over a year since your last visit, don't delay. Call your dentist today. There's no shame in taking action. It's a proactive step toward maintaining your vitality and confidence. Bonus secret: clean your tongue daily. Your tongue is the most overlooked part of your mouth, yet it harbors more bacteria than your gums or teeth combined. Its rough surface, full of tiny crevices, acts like a sponge, collecting a biofilm of microbes overnight that contributes to bad breath, gum disease, and systemic inflammation. By leaving this film unchecked, you allow bacteria to circulate through your body, disrupting nitric oxide and blood flow. Cleaning your tongue is quick and transformative. Use a tongue scraper, a simple, inexpensive tool available at any pharmacy, and gently run it from the back of your tongue to the front for 10 seconds each morning after brushing. One patient, Carl, a 68-year-old retired mechanic, added this step after years of ignoring his tongue. Within weeks, he reported fresher breath, more energy, and a noticeable improvement in his bedroom confidence. "It's like I cleared out the fog," he told me. This small habit reduces the bacterial load in your mouth, supporting healthy blood vessels and the circulation needed for erections. It's a daily reminder that you're in control, paying attention to the details that keep your body thriving. Conclusion: your mouth is the gateway to your vascular health, and your vascular health is the foundation of your erections. What happens along your gum line doesn't stay there. It travels through your bloodstream, shaping your body's ability to perform, connect, and thrive. By adopting these 5 dental habits, brushing with care twice daily, flossing every night, using interdental brushes, adding Lactobacillus reuteri probiotics, and scheduling regular professional cleanings, plus the bonus step of scraping your tongue, you can reduce inflammation, boost blood flow, and reclaim the vitality you thought was lost. I've spent over 2 decades watching men in their 60s and 70s rediscover their confidence, not through quick fixes or prescriptions, but through simple, disciplined habits. I've seen marriages rekindled, self-esteem restored, and men prove to themselves that aging doesn't mean surrender. It's about small, intentional choices: picking up your toothbrush with purpose, flossing with focus, booking that dental appointment, and scraping your tongue each morning. These acts of self-care ripple outward, strengthening your heart, your circulation, and your sense of self. If you've made it this far, thank you. It means you're serious about your health. Start tonight. Brush for 2 full minutes, floss carefully, try an interdental brush. Order those probiotic lozenges, schedule a cleaning, and scrape your tongue. Do it not because I said so, but because you deserve a body that responds, a life that feels vibrant, and relationships that stay strong. Your erections are a reflection of your vascular health, and your vascular health starts in your mouth. The tools are in your bathroom, gentlemen. Your vitality is waiting.